Cindy with Body Fit Physical Therapy, and wanted to talk to you a little bit about the psoas region or hip flexor region. There's a lot of information out there about, oh, we've got to really kind of cram our fingers or a device or something into that hip flexor psoas region to release it. You might be doing more harm than good if you're going too aggressively at it. There also is some improper stretching going on for the hip flexor that could not be effectively even stretching that region, and also maybe jeopardizing your low back or even your knees. So quick, easy things. If you do want to release that front area, I always do some rolling first. You can do some foam rolling on the quad and up into just below where the quad inserts there at the point of your pelvis. You can also take a ball like this, and if you want to put it between that point of your pelvis and just kind of in your belly button, you want to kind of push your tummy over, putting that ball here, letting it sink in just inside that point of the pelvis, and very gently lying on that. You're not digging into that hip flexor, that psoas. You're not even getting deep enough to do it, but sometimes just getting some pressure over that soft tissue will be a light release or just a light stretch for the tissue there, and that can make that area feel just a bit better before you go into stretching. So going into stretching with hip flexors, what we want to be careful with is that we don't overextend the back. We take the stretch off. So this stretch is putting the knee here. This would be the side I'm stretching. Other leg goes into 90-90 here. You're in a straight position here. All I'm going to do now is pelvic tilt posterior. So think of your pelvis like a bucket of water. I'm going to tilt it posterior, and then I will feel stretch right away. I don't need to lean into it. Don't need to go into this significant like runner's stretch. We don't need to go through all that, because then that just arches the back and we let the stretch off that area anyway. So coming back into that 90-90, posterior pelvic tilt, hold that position. If you want to do like an arm raise or even side bend, that works too. To stretch that out, you can hold it about 30 seconds, and you can do that 3, 4, 5 times on each side. Then another stretch that I like that really protects the back for some people is lying in your bed, or if you have like a higher bench. This is a little bit low, but I'll show you here. Lying down, hugging your knee up on that opposite side, and then letting the leg down on this side. This stretches that front area out, protects your back because we got the knee to chest. And then you hold that for like 30 seconds up to a minute. Doing 3, 4, 5 on each side. Obviously then you switch sides. Bring that knee up to your chest, letting that other leg down and going into that stretch. And those are a few ways to stretch the hip flexor.